Today, we'll talk about 3 common causes of unnatural-looking breasts after surgery. I'm Dr. Kim Koo-kyun, board-certified plastic surgeon at Human Plastic Surgery Clinic. There are generally 3 reasons why the breast shape looks unnatural after surgery. Poor choice of implant size, wrong implant type, and surgical technique or post-op care. Recently, many implants come in various widths and heights, which is an advantage. This allows us to correct breast asymmetry more effectively. But the wide range also makes it possible to insert overly large implants into slim bodies. If someone insists on larger sizes, the implant may become visible at the outer chest, and the height of the implant might not align with the nipple position. Using an implant that's too high can result in an obvious, bulging upper chest. The skin tone may look unnatural too, so choosing the right size is very important. In the past, saline implants were commonly used, but they weren't very stable or natural in texture. Nowadays, for various reasons, they're rarely used, and many patients replace them with silicone implants. Some modern silicone implants still have low fill levels, causing them to lose shape. Over time, such implants can wrinkle or fold inside the body. This leads to rippling, especially when the outer or lower skin becomes thin. The folded parts become sharp, causing discomfort or pain from inside. That's why implants are now evolving toward higher shape stability. They maintain shape better and reduce rippling and rupture risks over time. Shape-stable implants also help enhance both the upper and lower parts of the breast. If the area from the nipple to the bottom is smoothly extended, it creates a full, natural curve. That's why these implants are now widely recommended. It's also very important where the implant is placed during surgery. The main options are under the muscle or over the muscle. Placing it under the muscle hides the implant contour and gives a more natural look. For people who work out a lot, under muscle implants may feel uncomfortable during exercise. However, this is very rare and depends on workout intensity, so we don't see it as a major issue. In most cases, I recommend placing the implant under the muscle in a dual plane. But if, for some reason, the implant must be placed over the muscle, we use a fascia covering method. This technique is useful when the implant needs to be more visible. That's why deciding the surgical method through consultation is important. Post-op care is also crucial. You need to monitor the healing process closely to ensure a natural breast shape. This helps with choosing the right bra and recommending appropriate exercises. It depends on the surgical method and the doctor, but I personally believe that wearing a shaping bra early on helps patients feel more comfortable. I think the first 1 to 2 months are the most important for long-term breast shape. So regular checkups and proper management are essential.
People from rural areas may find it hard to come often.
That's why I tell them to come at least once a month. For patients abroad, I ask for regular photos. I give feedback monthly based on those pictures, like what exercises to do, when to stop wearing a bra, or which kind of bra to wear.
But the best option is
visiting in person. When you come for consultation, I ask about the breast shape and size you want. Then I do body measurements to decide the right implant width and size. I also determine the height and type of the implant. If the size matches your body, you'll get a natural, full, beautiful, and healthy breast. Many patients also worry about where the incision should be, but usually the incision location doesn't affect the final result much. So choose the area that feels less noticeable or visible for you. Absolutely. We first need to analyze the cause of the unnatural result. If it's not due to capsular contracture or other structural issues, we analyze whether the cause lies in the implant itself, or if it's an issue related to the implant size, placement, the stretching of the skin tissue, or its thickness. Then we can suggest a proper solution and surgical method based on accurate diagnosis. Therefore, it is important to consult with an experienced plastic surgeon to receive an accurate diagnosis and determine the most suitable surgical method for yourself. If you want a natural and satisfying result, remember these 3 key points. This has been Dr. Kim Koo-kyun, plastic surgeon. Thank you.